So if somebody is experiencing pain after surgery, it's important for us to know what's causing the pain. I often am talking to the patient, is it unilateral? Is it on one side versus the other? Is one side significantly more swollen? Are you having more bruising on one side? So these are things that I'm making sure there's not an immediate postoperative complication like a blood collection, a hematoma. If I've ruled that out, I do multimodal pain medicine. So I talk to them about taking Tylenol around the clock, Advil around the clock, or Motrin, ibuprofen around the clock if you are able to. I do prescribe a narcotic for breakthrough pain. And then I also prescribe something called gabapentin. That is treats more of like a nerve pain. So there's lots of nerves in the breast. They get angry at me when I do surgery on them. So if patients are having more of like a neuropathic type pain, I'll usually kind of push them more towards the gabapentin. And then, things that help reduce swelling because swelling is really uncomfortable. So, do I need to adjust your bra? Can we do some form of compression, kind of like around the upper part of your breasts? Those are the main ways that I treat it. We can offer an adjunct in surgery of a long acting numbing medicine to the area that lasts for like 3 days or so after surgery. I haven't found that to be necessary for these patients yet, but it is an option. So, in counseling patients for potential complications after a breast reduction, I always talk about a hematoma or a blood collection. I am dividing blood vessels during surgery. I take my time and make sure that I cauterize them or tie them off if necessary. I irrigate multiple times. I make sure that your blood pressure is well controlled during the surgery. These are all things that I do from a surgical technique to try to minimize hematoma. However, I have no control over what patients do when they go home. So it's usually any sudden increase in blood pressure that can cause a hematoma, cause, either a clot to break off or just a vessel to start bleeding. Heavy lifting is a big one. Straining, like if you're going to the restroom, if you're nauseous, and then if your blood pressure gets really high. So if you're somebody who has high blood pressure, making sure that it's well controlled before surgery and after surgery. We do a really good job of helping you manage post-operative nausea to prevent you from swelling and having that like Valsalva kind of response when you're nauseous or dry heaving. And then we are broken records when we are talking to you about activity restrictions.